Hello and welcome to our webinar entitled Revenue Cycle Pain Points, the Prior Authorization Headache. My name is Jason McDonald. I am the head of marketing at the Meditab Group, which includes Meditab, Dr. Catalyst, and a few other companies in the healthcare space. I have over 10 years of medical billing, revenue cycle management, and revenue growth experience, and I'm very excited to share some of that knowledge with you today. During today's webinar, I will reveal prior authorization pain points and explore solutions that allow you to get prior authorization approvals faster, easier, and more cost effectively. By the way, I know that today we have several different roles attending the webinar, including doctors, office managers, and front desk staff members. So I want to let you know that this webinar will provide knowledgeable tips and information for all of you. However, before we get started, let's go over a few housekeeping items. During the webinar, everyone will be on mute. If a question pops into your head during the presentation, please submit your question in the questions chat box. You don't have to wait until the end of the presentation to submit your questions. Just submit them right away so that you don't forget them. Then, at the end of the webinar presentation, we will do a question and answer segment, and we'll answer your questions. And if for some reason we don't have time to get to all of your questions, because we do have a pretty good sized group, then we will make sure that you receive an answer to any of your questions after the webinar. We will get in touch with you via email, okay? Also, the webinar is being recorded, and we will provide you with access to the recording following the webinar, okay? So let's go ahead and get started. So in a few slides, I'm going to share some valuable tips and tricks that we have learned from tens of thousands of hours of prior authorization phone calls. These tips and tricks will help you be more efficient when dealing with prior authorizations. But first, let me paint a picture about some of the challenges that practices like yours and patients are facing when dealing with the prior authorizations dilemma. The toll of prior authorizations is rising. Many physicians are feeling the impact of the prior authorization process, and they feel as if it's continuing to get worse. In fact, 86% of physicians feel as if the prior authorization burden has increased over the last 5 years. And 92% of physicians report the prior authorizations can have a negative impact on clinical outcomes. Also, 1/3 of practices employ staffers who spend every second of their working hours on prior authorization requests and follow-ups. Many of you already know a lot about prior authorizations. In fact, you probably know way more than you wish you knew. So for the sake of definitions, what is a prior authorization? A prior authorization is required in order for you to get paid on certain claims for procedures and medications. And while many of you already know about the headaches that are associated with obtaining prior authorizations, it may actually be a surprise for you to learn about the impacts of prior authorizations on the revenue cycle. In fact, did you know that it's one of the biggest reasons for loss of revenue among practices in the United States? That's a huge problem. So now that we understand how big of a burden prior authorizations are on the lives of physicians, office staff, patients, the question we must answer now is, how can we fix the problem? What can we do to ease the burden? Stand by for a little bit more information about prior auths, followed by some ways to improve the prior authorization process in your medical practice. It's common for physicians to face prior authorization burdens for new or unusually expensive medications or tests. But more recently, insurers have rapidly added PA requirements to more and more treatments and procedures. And this makes the process even harder to complete. PA rejections and other complications cause delays that affect your delivery of care. This means that patients don't get the treatment or the medication they need on time. Your workflow takes disorganized bends and turns, And of course, you don't get paid on time. Prior authorizations are a major burden. In fact, when physicians were surveyed about the average prior authorization wait time for them and their staff, the results were staggering. 64% reported waiting at least 1 business day, and 3% reported waiting at least 3 business days. These long wait times leave patients untreated, tie up phone lines, require a significant amount of time from staff members, put patients in a situation where they tend to blame physicians, plus more. And according to a new survey by the American Medical Association, prior authorization issues are associated with 92% of care delays. They may contribute to patient safety concerns as well as administrative inefficiencies. I like to use this example. The next time you pass by the waiting room at your practice, look at the patients sitting there. If 10% of those patients needed prior authorization approvals, then out of those 10, 9 of them would experience some type of care delay due to prior authorization approval. In other words, 9 out of 10 patients could potentially receive a care delay. That's pretty unbelievable, right? Additionally, on average, a medical practice will complete 29.1 PA requests per physician per week, which takes 14.6 hours to process. And about half of the requests are for medical services, while the other half are for prescriptions. So basically, the amount of time that should be spent taking care of patients is now used to do follow-ups for prior authorizations, which ultimately delays patient treatment. We see also that PA is rarely on time, so practices often experience unwanted delays in care. And that's in addition to a handful of other challenges, which include lost productivity, additional operational costs, workflow disruptions, delayed payments, clinical personnel dissatisfaction, bandwidth constraints, slow turnaround time, decreased quality of care, poor staff morale, turnover, and the list goes on. And as you all know, the process of obtaining prior authorization can be a lengthy administrative nightmare of recurring paperwork, multiple phone calls, and bureaucratic battles that can delay or disrupt a patient's access to vital care. The percentages of patients that tend to abandon their treatments because of PA delays are alarming. Only less than 20% do not abandon. This leads to poor outcomes and, on your part, lost revenue. Now that you have a better understanding of the growing prior authorization burden, I'd like to share a few prior authorization tips and tricks. We actually have a team of 250 clinical nurses that make phone calls day in and day out to capture prior authorizations for our medical practice customers. And then we enter them directly into the EHR system of the customer. So we happen to know a thing or two about how to successfully process prior authorizations, and we want to share those tips with you. So here we go. First, when you call a claims adjuster for the first time and they don't pick up, leave them a voicemail with your name, claim number, and the requested procedure and callback number. Then immediately after you leave the voicemail and hang up, call them right back, because sometimes you'll actually reach that person. Also, if you have several patients that have the same insurance provider, group them together and be prepared to give the insurance company all of the information on one phone call. Rather than calling back for each additional patient, this is a great tip that will help you save a lot of time. Oftentimes, the guidelines for insurance companies can be very tedious and complex. Therefore, make sure that you understand each insurance company's guidelines before you submit a prior authorization request. Finally, figuring out the request forms can be a nightmare and very time-consuming. So to help with the process, try pre-filling the request forms with recurring office and provider information. While the typical prior authorization request process is time-consuming, challenging, and very frustrating, These are a few tips that can help make the process a little bit more manageable for you. And contrary to what you might expect, solving the prior authorization problems isn't such a monumental task. We're going to look into the top 3 solutions that are proven to relieve or even cure your PA headache, although not all of them are optimal and cost-effective. Training and expanding your current staff improves your efficiency and enables them to work around problems quickly, but it is costly and time-consuming. So while you might have the budget to do this, your busy day-to-day operations may make it so that you can never actually have the bandwidth to accommodate training sessions in your workplace. Using an EHR system to manage prior authorizations is also a proven immediate solution. But do you want to know what makes it even better? A dedicated remote staff that handles your EHR for you. Let's explore the outsourcing solution a little further. Outsourcing staff is a solution that many practices are currently turning to, and remote staff members can actually be particularly helpful when it comes to the prior authorization process. In the event you need help with processing and completing your prior authorizations, Dr. Catalyst is here to help you. Have you ever wished you had 250 clinical nurses that could drive your EHR? We're actually doing that now for over 100 medical practices across America. This helps to free them from the administrative nightmare of modern-day medicine so that they can spend more of their time with patients and less of their time with paperwork. We can work with any EHR to streamline your office workflow. Additionally, with our EHR expertise, we offer a number of clinical, administrative, and billing services to help you eliminate the problems that are caused by prior authorizations. We can take care of prior authorizations for you very cost-effectively so that you can care for your patients. Let me share a few of the ways that Dr. Catalyst can serve as a valuable partner in your medical practice. For starters, Dr. Catalyst's 250 plus clinical nurses can call the insurance carriers for you and complete the insurance eligibility verification process. And then if the insurance company requires an authorization, they can do that on the same phone call. This will free up your front desk so that the office staff can spend time doing more valuable things like taking care of your patients. We know that's the most important thing for you. Dr. Catalyst can also handle your RCM and medical billing needs. We can enter and submit charges. We can make accounts receivable follow-up calls with the payers and post payments from ERAs and EOBs into your billing software. Or maybe you just want help with some of the process. You could pick a number on the screen and we could help you with just that part of the process that is the biggest headache for you. Dr. Catalyst also offers services that can handle everything from front and back office operations. So a few of the standout services include document and fax management, where we can label and assign your incoming faxes to the correct office staff so that there's no delay in patient care or communication with other medical practices like referring physicians. Additionally, chronic care management will actually help you set up a chronic care management program. Chronic care management is a service that Medicare reimburses an average of $50 per month per patient for you making a 20-minute phone call to your patients. So that's something that we can help you with. Those are just a few of the services that we offer, but truthfully, that doesn't even begin to scratch the surface of the number of ways we can actually help your medical practice. We also create personalized marketing solutions for practices. We recognize that each healthcare practice has different marketing needs, and that's why we tailor-make marketing strategies to fit your preferences. Honestly, the power of marketing is huge. Just think about it. When your practice is found by more patients and you have a positive online reputation, then your practice will begin to grow. So let us help you. We provide marketing services in the following areas. Website design. We can create a custom website from scratch. search engine optimization so that Google and the search engines can find your website easier. We also do patient phone surveys, and we help get you Google reviews online. So regardless of your specialty, Dr. Catalyst can provide you with cost-effective, high-quality marketing services. On the next few slides, I'm going to show you some examples of the websites that we've created for some of our customers. This website was for an orthopedic client, Nora, and we created a nice customized and personalized website. And what's so great about this website is that it highlights the orthopedic specialty. It's also user-friendly, and it caters to the patients by allowing them to easily make appointments, fill out patient forms, and many other things. We've also built and designed websites for women health clinics, such as this one for Dr. Anionia. We've also created a website for one of our clients that focused on Ahmed services. On their website, you can learn more about their services, get healthy tips, and download patient forms. We've also created and optimized websites like this one for clients in the allergy and asthma field. In addition to website design, as I mentioned earlier, we can help you get more positive Google reviews from your patients. Look, at the end of the day, every business has gotten a bad review at one time or another. If you have a bad review, don't let that get you down or worried. Instead, work with us to ensure that your online reviews are handled with care. That's what Dr. Catalyst is all about. Whether you're providing services to make your authorizations more streamlined, or helping you build your brand through our marketing services, we are here to help. Now let's switch gears a little bit and look at how EHR and billing software should be configured to meet your demands on the authorization process. Think of this as a handy checklist for what you really need to think about on the authorization side when you select a billing and EHR software. If you oversee or work at a practice, you probably experience night sweats when it comes to dealing with prior auths. If you're spreading your staff thin in an attempt to submit prior authorization requests in a timely manner, an EHR and billing solution can help. Your EHR and billing software is where you track your prior authorizations. So it's critical that you choose an EMR and billing software that adequately meets your prior authorization requirements. So I just want to share a short checklist of the things that a leading software should be able to help you and your practice do on the authorization front. First, the software that you select or use should be able to track the number of visits allowed when an authorization is approved. Additionally, your software should be able to track which CPT and ICD codes are allowed with that authorization. So as we all know, these codes are the way that physicians and payers communicate. Don't you think that your EHR and billing software should support that? Of course. So really, it's important for several reasons, but one of the main reasons is because it can help your practice if there is ever a payment dispute. Thanks to these two codes, your practice will have assurance that the procedure will be paid by the payer since the code gives them the approval to do so. In general, there are a ton of prior authorization requests that are made each month. And honestly, it's not that easy to check on each individual request. And that's one of the benefits of an EHR and billing software. It can help you keep track of your approved prior authorizations and keep tabs on them when they expire. And it would be better if your software has a filtering system that helps to speed up the process of finding out which authorizations are about to expire. And having a filtering system could also benefit patients because the staff members at your practice would then be able to see which authorizations are about to expire, and they can prioritize them accordingly. The last item on the checklist is to make sure that your EHR and billing software allows you to add important patient data into a form. Now, most billing software allows you to fill out forms, print, and then fax them to the appropriate payer. This is the basic functionality of a billing software. A more advanced option would be a system that allows automation and an auto-population functionality. As you could tell, EHR and billing software can be a very valuable tool in the prior authorization process. Now that you have a good idea of how EHR and billing software can help with the prior authorization process, I want to share with you a leading EHR and billing software that checks off every feature mentioned on the checklist and more. By sharing this, I want to give you some ideas about the ways that you can leverage your own EHR. Some of these features should already be included with your EHR, and maybe you didn't know that they existed. So make sure that you keep notes here and make sure that you contact your vendor, or you can find a vendor that offers these specific features to make you much more efficient. Metatab and IMS have been around and thriving for over 20 years. And honestly, in this industry, that's no easy feat. And throughout those 20 years, Metatab has helped many physicians, have successful practices. From allergy clinics to fertility centers, what's so great about Metatab software is that it's able to adapt to every medical specialty. And Metatab understands that practices come in all shapes and sizes. And that's why, in addition to IMS's veteran status, it's a customizable and it can adapt to the workflow of every practice, no matter the size or the specialty of that practice. Oh, and did I mention that IMS is able to automate the prior authorization process? Thanks to its auto authorization tracking module, it can make the prior authorization process for your practice more efficient, more manageable, and far less time consuming. But honestly, you don't have to take my word for it. Shortly, I'll personally show you IMS's authorization tracking module and explain how it can improve the prior authorization process at your practice. Dr. Catalyst's 250 remote nurses are also very knowledgeable about IMS. In fact, every one of them is certified IMS users. So you can utilize the nurses to drive your EHR and take the lead on improving the prior authorization process at your practice. Now, as promised, let's take a little bit closer look at IMS's authorization tracking module. Using IMS's authorization tracking module is so simple, yet very effective. Basically, in 3 easy steps, you can add all of your patient's information into a form or a letter template, and then you can submit it to the appropriate payer. After you select a patient in IMS, you simply choose the form or letter template that you want to be filled out, click the Form Fill button to auto-generate all of the patient's information into the form, and then you submit the form or letter template. You can either choose to automatically fax it, or you can print it and save it. How easy is that? 3 simple steps, and you have a completed prior authorization request. I know that most of you are probably, like me, a visual learner. So now let's take a look at how the process would actually look in the IMS system. Let's say that you want to fill out a prior authorization request for a patient John Doe. Once you log into IMS, you can go to the authorization tracking module, and once in the module, you will see that the screen houses all of your patients. You would then locate John Doe. Now, after you locate his name, click on the paper icon with the check mark. That is the prior authorization form icon. Once you click on that icon, a pop-up box will appear with a list of prior authorization forms. Select the appropriate one. After you select the proper form, click Fill Form. In this instance, we want to fill out a United Healthcare form for John Doe. Next is where the auto-generated magic is going to happen. Once you click the Fill Form button, the patient's information will be auto-generated into the form. So essentially, with just the click of a button, you can have all of your patient's information added to a form. This means that the days of manually inserting all the patient's information into forms is behind you. Just think of how much time you and the others at your practice will save. Now, once the patient's information has automatically populated into each field, you can automatically fax the form to the appropriate payer. Yes, I said automatically. I know, it's a foreign word when it comes to prior authorizations, right? But IMS is aiming to change that. Now, once you click the fax button, it's going to take you to this screen. Just confirm the patient's name, the referral source, and the insurance company information. Then you can have the document automatically faxed over. The fax automation is one of the things that really stands out about IMS. Honestly, IMS makes the prior authorization request process super easy. From filling out the prior authorization form to actually sending the form off to payers, IMS helps you streamline the entire process. The best part about it is that this process usually takes 5 to 10 minutes for each request, but with IMS, it takes less than 1 minute. So there are several benefits to using an on-demand staffing and EHR software. When it comes to demand staffing, Dr. Catalyst has been able to help clients with all of the parts of the revenue cycle, from prior authorization approvals to claims to accounts receivable management. This is an example on the screen of our client, Asthma and Allergy of Idaho and Nevada. They were having RCM and billing challenges at the practice, and since joining as a client, we've been able to help them resolve issues in different areas such as claims and accounts receivable. Here's another client. Columbia Allergy and Asthma Clinic has benefited from the fact that we always have remote staff members available for your needs. Also, this particular client enjoys the fact that the services that Dr. Catalyst provides are now very compatible with Meditab's IMS solution. And as you saw during the webinar, combining on-demand staffing with 250 clinical nurses and a leading EHR system is a great solution for tackling the prior authorization headache that we've covered today. We know that the prior authorization process is quite frustrating, and it is a growing problem. And honestly, there's no aspirin strong enough to relieve the prior authorization headache, if we're being honest. However, with a good solution in place and a trusted partner by your side, you can make the prior authorization headache less severe. Let us help you with that. If any of you are interested in continuing this conversation, I'd suggest setting up a free consultation with our Dr. Catalyst team or arranging a live demo with our Meditab team so that we can help you overcome some of your prior authorization woes. On the screen, you can see our phone numbers. And now we'd like to take some time to answer questions that anybody on the webinar has.
Hi, so I'm just going to jump right in. So it looks like we have a couple of questions that have come through during this webinar. So the first question that we have, I'll just read it out to you guys, and then Jason and our team will answer them. So the question is, how do you deal with patients who have an insurance plan that requires prior authorization for a consult? However, they are a new patient that they have not been seen yet. Therefore, as a practice, what do you recommend? So should they submit a prior authorization for the patient that they haven't been there yet, or ask the patient to request a prior authorization before their first visit? Most of the time, we do not realize that needed as a prior authorization for a consult until after they file the claim, since our practice is an out-of-network provider. So basically, I think this attendee just wants to know, how do they deal with patients who have an insurance plan that requires prior authorization for a consult?
Thank you, Tiffany. Ariel, how does your team of clinical nurses deal with this scenario? And I want to underscore something. I think this is a great question, and I want to thank the audience for all of your questions. You know, your questions help us to have dialogue and collaboration with you, and we absolutely love providing help. So, Ariel, I think there are two things in this question. Number one, when a new patient comes into the office and they've not been seen yet, how do we manage the prior authorization process? And then, Ariel, the second thing that I heard that kind of caught my attention was the fact that they're out of network. So my question to you, Ariel, would be, is the out of network aspect, does it change anything when it comes to prior authorizations when your team works on the prior authorization? So Ariel, can you shed some light on this for us?
Mhm. Yep. Thank you, Jason. So with the first question that we have, when a new patient would come into the clinic, it would be the referring physician who would get the authorization for that patient to be seen in the clinic's practice. Now, with the second question, when it comes to out of network, the best thing that we do for that is before we see the patient, we have to check first with the payer if we are allowed to see the patient and does the patient have other active insurance which we could see or we are in network with, just to make sure we have together the eligibility and benefits for that patient.
That's great, Ariel. So when we have a new patient that comes in, we want to call and verify benefits, right? And find out exactly what the coverage includes. And if they're authorized to be seen at this by this physician for this procedure. Is that correct?
Correct. Otherwise, if the patient is not authorized to see the doctor, then the patient would have to do a self-pay.
Okay, fantastic. Thank you, Ariel, for helping us and guiding us through that process. The next question is from Janian, and I'm sorry, Janian, if I mispronounce your name. Janian asks, should you go through the authorization tracking screen or go through the Cover My Meds button? So Ariel, do you know how to answer that one for Janian?
hmm So yes, I think this question is about the IMS. So
Correct.
when it comes to the Cover My Meds, it's what we call prior authorization for medication. We actually have a separate module for that in the IMS. That's what we call EPA. That's under the activities. So the tracking system for the medication is different from the authorization tracking. Mainly what we do with authorization tracking is or are the kind of procedures that can be done in office or should be referred out to another specialty. Now with the EPA, that is directly integrated into the Cover My Meds. So there's a button there that when we click Start EPA, that would link us to the Cover My Meds and let us complete the questionnaire from the payer through the Cover My Meds website.
That's great. Thank you, Ariel. Mia has a question. She says, in a lot of prior authorization request forms, we need to input the diagnosis codes. However, this isn't something we have until the doctor has seen the patient. How do we protect ourselves in the event that we see a patient to get necessary diagnosis codes before we have the authorization itself? Ariel, how would you answer that one?
hmm So for us, we have to review first the report of the doctor just to confirm the all the data entry or all the information are matching. So for an example, the doctor requests this kind of MRI for the lower back, and then when we see on the report of the doctor that the diagnosis is only for the cervical spine or the thoracic spine, then we have to consult with the doctor about that before we submit the prior auth. So the key point there is review first the request before sending it out to the payer.
Okay. And I think, Ariel, if I understood the question, I think she was saying that they have to put the DX codes into the prior auth, but they don't know what the DX codes are because the patient hasn't seen the doctor yet.
Mm-hmm.
So I guess this is, I'm guessing Mia is in a practice that's maybe multi-specialty and they have different types of procedures. So Ariel, when you work with a new client and you do onboarding for them, do you ask them for a list of their common procedures so that the person that calls to get the authorizations can kind of narrow it down because they know it's going to be one of a couple types of procedures. Is that the idea?
Yes. So basically, what we do when we start with a new practice or a new client is we gather the common CPT codes that they submit to the payer, so that we know what are the things that we have to look into in the visit note. Um, so with Mia's question on the diagnosis prior to the patient being seen in the clinic, is that I think it's better that we submit the request after the patient has been seen by the doctor. That way we can determine what is the diagnosis that should be linked to that procedure code.
Yeah, the challenge with that, of course, Ariel, is that the practice might see a patient and then not get reimbursed for it. So
Mm-hmm.
I think what Mia is asking is there a way to avoid that? And I know that when you take on new customers, one of the things that you do is you ask for commonly seen procedures for that practice.
Mm-hmm.
So maybe what Mia could do is this is not always possible because, like you said, and like Mia said, we don't know what the procedure is going to be until the doctor actually sees the patient. However, in some practices, you can, if the patient calls and says, you know, this is my symptom, and if it's a practice that does, you know, 5 types of procedures, and one of those procedures fixes the symptom that the patient expressed on the phone, I think then you could call and get a prior auth for that. And
Mm-hmm.
if you get a prior auth for that, and then the doctor sees the patient for something different, then of course I think you have to deal with it at that point. But maybe this is one way that Mia could protect the practice. So what she might do, and I want you to tell us, Ariel, if this is a smart strategy, could she ask the doctor for the most common list of CPTs that he typically does with patients, and then create a little bit of a map that when a patient schedules an appointment for this problem, usually this is the procedure for it?
Mm-hmm. I think it's not advisable to do that because
Okay.
we are like creating a trying to create a diagnosis which is not yet indicated by the doctor. So the best
Uh,
thing that we can do for that is after the procedure, after the consult, we can then submit a retro request for authorization. So that means the procedure is done before we submit the request for the approval from the insurance. The some payers would allow that kind of request. So we have
oh.
to check first with insurance if they would authorize retro request for authorization.
Okay, it looks like Mia actually gave us a follow-up question, and I want to thank Mia for that. She said she's in a chiropractic office, and they have patients that come in without a referral all the time, and they can't send in an authorization beforehand because they don't know what is going on until they have been seen. And so she says, what if we don't get the authorization, but we had to see the patient to even attempt to get an auth?
hmm So the best thing that me can do with that is they have to contact the referring physician's office. They have to get the approval first because it's the responsibility of the referring physician's office to get the approval for the patient to be seen by a chiropractic practice. So yep, me have to call the referring physician, get those authorization and other referral staff.
But she said they have patients that come in without an author or without a referral all the time.
hmm So I guess the best thing that Mia can do with that is they have to check first with the patient's insurance to see if the patient is covered with this kind of procedure. So by the time that when they submit the claim or submit the retro authorization, then they can be paid since they have the proof that they have confirmed the eligibility and the benefits coverage for the patient.
Exactly. So Ariel, it sounds like what you're suggesting is always call and do a very good insurance eligibility verification with the payer. Ask the right questions, right? And in a chiropractic setting, I think you're typically doing a handful of CPTs. I could be wrong about this, Mia, but I think you're usually doing a handful of CPTs. So you could call and see if the patient is covered for those things.
Correct.
Uh, Okay, that's good. Thank you, Ariel, and thank you for your questions, Mia. These are great questions. The next question comes from Ashley. She says, I do not have a pop-up to choose from insurances. How can we have this set up? My guess, Ariel, is that Ashley is using Metatab IMS. So it sounds like she needs help setting up the authorization form letters. Ashley, if you're hearing me, could you confirm, is that accurate that you're an IMS user and you need help setting up the form letters? I think let's assume the answer is yes, Ariel. Is there a good instruction we could give her on how to set those up?
So with setting up the forms to be filled, that can be done in the setup, but it's only the super user who could do the setup for that. What they can do is they can have they can contact their account manager in Meditab and have them schedule a training with one of the implementers so they can be trained on how to set up a form. That's pretty easy process, but it's the implementation who could directly give them the actual training to set it up.
Fantastic. So Ashley, you probably know who your account manager is. If for some reason you don't, please let us know and we can make sure that your account manager schedules a time to get your implementation person to help train you on how to set this up, okay? It looks like Melissa said, and this may be a misspelling, I think it came across as MELISS. So Melissa said, how do you get a prior authorization from the referring physician if they are a hospital? A lot of our patients are from hospital emergency rooms. Most of them don't realize they are out of network until they show up at our office.
hmm So basically what the referring physician or the hospital will do is they contact the clinic. They're trying to see if the patient will be accepted with this kind of insurance. And if, for an example, the patient would come in and doesn't know that his insurance is in network with that provider, the best thing that they can do is try to check first quickly with the insurance to see if the patient is covered for that kind of procedure or consultation. I think, yeah, that's the best thing that they can do.
I wonder, this is, I'm not nearly as comfortable with the authorization process as you are, Ariel, but I wonder if the practice might communicate with the administrator or the manager of the emergency room and ask them if they might educate the patient that, every practice is different and the practice may or may not be in network or the patient's insurance may not be covered by the practice. I wonder if the practice could contact the referring practices like the ER and just have good communication in place so that they could communicate that to the patient before referring the patient. That way the patient doesn't get caught by surprise when they arrive to Melissa's practice.
Correct. And also with other referring offices, what they do is they print out the referral documents, give it to the patient, instruct the patient that please give this office a call. They are going to see you for this kind of consultation. Um, Most of the practices or specialty clinics, they don't usually in, but they do schedule you first. That is a preventive way of helping patients that are not in network with their practice. So yes, to what you mentioned, Jason,
Hey,
communication with.
Ariel, you're having, I believe, some internet problems. I think you're
Mhm.
cutting in and out a little bit.
Oh, I'm sorry for
Um,
that.
yeah, it's okay. Maybe you could
Mm.
repeat the last part.
Yes. So the last part I mentioned was the specialist office with like Melissa's office, they have to communicate well with the common referring office so that they can, for example, a patient practice. and then without them having verified the insurance first, if the patient is
Ariel, maybe you could call in. Maybe you could call in from a phone because you're cutting in and out. I apologize. I think Ariel was having some challenges with his internet connections. So while we wait for Ariel, there's another question, and I think Melissa responded that you've communicated to the hospital many times, and they don't do a great job of educating the patients. And so my feedback or counsel to you, Melissa, would be that maybe you could give a little bit of thought to the right communication process with those patients, because we know that they're being sent to you from the hospital and they're just entrusting the hospital that their insurance would cover the visit with you. So perhaps that could be the very first thing you tell them. You could say, hey, the ER is very busy, and sometimes, since they're so busy, there's a chance they refer patients to our practice, and they're not always covered by our insurance. So the first thing we like to do, Mr. Patient, is call the insurance company and verify your benefits. Melissa, you may already be doing this, and if you are, I think that's fantastic. But if not, maybe spend a little bit of time thinking about how to communicate proactively to the patient and saying, listen, you might not be covered, and if that's the case, I apologize. And then tell them that you're going to verify the benefits. I think that's one potential solution. And then we had another question from Jennifer. This is a great question. Jennifer asked, that's very helpful that forms and letter templates can be auto-generated in IMS. Can you explain the difference between forms and letter templates in IMS a little bit more? So Ariel will be rejoining. Ariel, are you back?
Hi, Jason. Yeah, I'm back. Sorry for that.
Thank you. Oh, it's okay. I know technical difficulties happen. So you heard the question from Jennifer about letter templates versus forms?
Correct. Yes.
Okay.
So the main difference between the two is we use the form for a specific or because what we know is commercial insurances have different designs on their forms. They have their logos and other stuff, which hard to not that easy to copy when it comes to making a letter template. So what we do with that is we mainly use the forms to be filled for those kind of documents, and then with letter template we mainly use that kind of form to create a request for authorization form that can be set up in a Word format. The good example for a letter template would be the DWC RFA form or the workers' comp request for authorization form in California. The design is more on tables only, so it's pretty easy to copy that using a letter template. But with other insurances like United Healthcare, Blue Cross, Cigna, Aetna, and other commercial insurances, they have different designs. So the best thing that we can do to automate the filling out of those forms is to use the forms to be filled. Last thing would be the output of the forms to be filled would be on a JPEG or through a .tiff format. But when it comes to the letter template, the output document would be in a form of a Word kind of document.
So a Microsoft Word versus an image file, right?
Image file, correct.
Okay, perfect. Thank you, Ariel. Nicole asked us a really good question. She says, what about the times when we call the insurance company and they say that no prior authorization is required? However, the claim is then denied because we did not get the prior authorization.
Mm-hmm. Yes, so we also encounter those kind of situation. The best thing that they can do with that is once they contact the insurance and the insurance agent would say there's no authorization needed for this kind of procedure, then they have to get a reference number. Reference number is like a call identification number wherein it would indicate that what time, what date did they call the insurance to verify that kind of procedure. So that way they can file an appeal on the claim that they made this kind of query from the insurance, and they have this reference number, and in that reference number, it has a data on the insurance stating that one of the insurance agents spoke with this person from the clinic, and the insurance agent stated that this procedure is not needed. So best thing to do is get a reference number.
That's great. A reference number is such a good idea. I think that wraps up our questions. To the moderators of the webinar, it looks like we got another question. This is great. Tina, you say that, here's Tina's question. You mentioned that Dr. Catalyst outsourcing services can work well with Meditab's EHR system. Can you explain that a little more? Can you give me a good example of how it would benefit my practice to utilize both? Tina, thank you so much for asking the question about how Dr. Catalyst can help with Meditab's EHR. So the short answer is that any functions that your practice currently does that doesn't require an office staff member to work with a patient. So in other words, if it doesn't require an office staff to be in the office, everything else that you do in the Meditab software, or when you're calling a payer, or you're managing a referring physician, or you're answering a phone, or you're reminding a patient to come to the office, all of those other things are things that Dr. Catalyst can do. So in essence, Dr. Catalyst can do a handful of different services. One, Dr. Catalyst can manage your incoming faxes. We can review every fax, label it, and then assign it to the right staff member. It's funny, fax machines are kind of like the heart of a medical practice, and what happens is practices are so busy they can't keep up with their faxes. So Ariel's team actually manages incoming faxes. Ariel, can you talk just a little bit? I think Tina would like to hear this. Can you talk a little bit about how you manage incoming faxes that come into IMS? What process do you take? How do you assign them, that kind of thing? I think that would be helpful for Tina.
Yes, Tina. So what we basically do in Dr. Catalyst is that we can come in like 2 hours ahead of your office work hours, and we can then link those incoming faxes to the patient's chart, put the category, the description, and then forward to someone in the office who would do the next process for that kind of document. In the case that there is a problem on your faxes, technical issue, we can then directly communicate with the Meditab technical support. Since we are just a sister company, communication with them is pretty easy. So we can then have a quick fix to your faxes if that happens.
That's great. Thank you, Ariel. And Tina, the other things that we can do for your practice there's kind of a long list, most of which are listed on the drcatalyst.com website. And we could schedule a time for you to have a free consultation from our team. But in essence, we can do everything from the entire revenue cycle. We can make phone calls to insurance companies to get eligibility verification done for you. We can process the prior authorizations for you. With patients, we can take incoming phone calls and act as a remote receptionist. We can call your patients proactively, reminding them to come into the office. We even have physicians on our team that call patients and take prior medical history and enter it into the chart so that when the doctor sits down with the patient, the chart note, a lot of it is already done for them. So it simplifies the process and accelerates the delivery of care. So there's a lot of things that we can do. And that's a really good question. Thank you for asking that, Tina. I think that may wrap up the questions that we have. To my moderator team, do we have any more questions from the audience? I think that does it. Wonderful. Well, thank you all. We had a wonderful time sharing the prior authorization problems and solutions with you all. We hope that this was helpful for everybody that attended. If anybody has any follow-up questions, we have a full team of people that can help you answer questions about how you can do this in your own IMS software, or if you're using something different and you have questions about anything that you heard, or you just want to get advice about how to do certain things, please do let us know. We're always here to help you. And there is a contact form on drcatalyst.com. Additionally, you can call us anytime at these two phone numbers. The first number, 510-628-6005. That's Dr. Catalyst, so call us if you have questions. If you need to speak with somebody at IMS Meditab, call 510-201-0130. And I'm just sharing this because we had so many wonderful questions. We're here to help if you have additional questions, okay? Thank you, everybody. Have a wonderful day. That concludes our webinar.